If you're somebody suffering with SI joint pain and it's super intense, a waistband can be super beneficial just to hold it in place, but I want to go through 3 simple movements that can help to alleviate that sharp, intense pain that you're currently feeling. Check this out. So the first thing we want to do is to try to get on the floor. I'm going to lie flat on my back, press my hands into the floor. Now, obviously, I've got the waistband on. If you don't, you could put a yoga block in between your knees just to remind you to keep tension and support. I'm going to press down, lift my toes, drive my hips up as high as I can as I really try to tuck my pelvis in this position. I'm pulling the ribs down, driving the hips up. I hold for 60 seconds, and I might even bring in some pulses whilst really squeezing the glutes. I'm kind of watching to see how good my left and right are able to carry out this movement. The next thing we can do is we ditch the band. So we want to bring in a bit of movement. Grab yourself a roller, and then I want you to set yourself up near a wall or a box. I want you to bring your feet up onto the box or press against the wall. And I'm going to use the cylinder as a way of rotating my hips. So what I want you to watch here is I'm keeping my hips on the floor. Then I'm going to push one knee up, push it back down. Opposite knee up, push it back down. So I'm just trying to get a little bit of rotation into my hip here, which will help when I stand back up and try to walk. Do this for 60 seconds. Focus on the quality of the reps, not just how many reps you're doing. The last one, what we're going to look to do now is actually lengthen the tissue here so that we can get out of that pulled anterior kind of position of the hip, which is putting a lot of pressure in the lower back. All I want you to do is to come close to a wall, bring your knee down so that your shin is ideally touching the wall. If you can't get into a lunge position, bring the knee away from the box. From here, we're going to come into an upright position, or as best we can. We're trying to tuck that pelvis again, feeling that nice stretch along the front of the body. Big deep breaths in through the nose. And then as you breathe out, just see how much you can soften your belly. Aim for 60 seconds on one side, and then swap over to the opposite side. The thing with SI joint pain is I know how intense this can be. Having something like a waistband is obviously good to just give you initial support, but we want to get movement in there as best we can. Get out, get some walks, focus on your breath, and go through those 3 basic movements. If you are struggling with them and you need a little bit more support, don't hesitate to reach out. You're welcome.